Assalamualaikum and good morning. My name is Muhammad Kasim Abdullah. My metric number is 320412211001. I am student of KPJ Healthcare College, Penang. Today we're going to talk about a case study that has been requested by my Madam Nurul Amira Zakaria, for the subject of PHOS for 312. So I am from cohort 20 basically. So the case study that we're going to talk about is bladder cancer in a pharmacist. So it's a NIOSH case report. So next. So introduction for the case. So occupational disease occur due to the workplace exposed to harmful agent. So healthcare workers are at risk during handling and preparing medications. So psychotoxic drugs used in chemotherapy are hazardous to human health. This case study is reported from the National Institute for Occupational Safety and Health, NIOSH. So let's move in. So the case study is about a 39 years old pharmacist, and he or she worked in a hospital IV preparation unit and exposed to the psychotoxic drug for 20 months, and the patient has been developed the bladder cancer after 12 years. So lesson is workplace safety in healthcare is critical. In this case, we can study about that. So the disease is bladder cancer. The type that we get in the article is papillary transactional cell carcinoma. So the symptom of this disease or this type of disease is blood in urine or hematuria, and then the serious long-term occupational disease that we find out in the article. So type of hazard is a chemical hazard due to the psychotoxic drug exposure of the psychotoxic drug. So the type of psychotoxic drug is cyclophosphamide, methotrexate, doxorubicin, and cisplatin. So this is the drugs that has made the patient to the bladder cancer. So cause of the condition. So the cause is long-term exposure due to the hazardous drug. So because of the long term, so the patient get a bladder cancer, and then improper airflow cabinet also might happen, and then lack of proper protection, and then repeated exposure over time. So diagnosis and timelines. The patient have the symptom blood in urine. Diagnosis shows that he have a bladder cancer and exposed to 20 months in a report. And then disease appear after 12 years. It shows the long latency period. And then in conclusion, occupational exposure can cause cancer, and effect may appear years later. Safety measurement are essential. Early prevention is critical. So the awareness and prevention that we can use to prevent this thing happen, so we can use the full PPE, such as glove, mask, gown, or use the biological safety cabinet. Yeah, we have a SOP for preparing the psychotoxic drug, right? So we can use the SOP and guidelines that has been established by government, and then a regular health monitor also important for this kind of workplace lah. The people who work in this workplace, they need this. So this is the reference that I get from the National Institute of Occupational Safety and Health, NIOSH 2004. And then thank you for everyone for listening me.